Right before we get started, I just wanted to take a second and thank all of the speakers for all the time that they took to put into these presentations, take the time to come out and make their presentations. To all the speakers, thank you so very, very, very much.
All right, we're going to start with our panelists with the questions that were left outside, and I've sort of grouped them together for sort of thematically. So from the business track, the entrepreneurs discussed the importance of training and implementing system of profound knowledge. What are the pros and cons of sending people out for training versus bringing trainers in-house?
Well, the advantage of having the training brought in-house, it's likely per person cheaper. And you get to tell inside stories because everybody's living it. We don't have to worry about outsiders hearing it. The advantage of going outside is you get to hear other people's stories, and you realize where I work is just like where everybody else works. You're not as special. But I tell people is if it's in-house, then you get to go off target and say, hey, how can I apply this over there that you cannot do? So I think that's one of the major advantages, assuming that the talent of the training is the same. What I also find is there are people inside that won't take training inside, that have to go outside, either because they don't want to look stupid in front of underlings, in which case I tell people then have them go offsite. So there's advantages. I think you have to have the capacity to do both.
Thank you. Any else want to comment? I see agreement.
Yeah.
Okay. Sort of related to that is, can you talk about how long you've been using the Deming method, and what do you anticipate the longevity is of the program? That's so easy.
So I think the core aspects of it go actually back to the Renaissance. And it's basically a scientific method. And I think that's the fundamental part. The other parts are, okay, how do you interpret the data that you generate using knowledge of variation and things along that line. The psychology we understand today probably will be different than the psychology we understand in 10 to 15 years, but it's still going to be there. The human's still going to be part of it. And as far as I know, we'll always be part of systems.
Great, thank you. The next question, describe your experiences in coaching system of profound knowledge. Keith, you want to?
Yeah. Well, I mean, it's pretty new for us. We've only just trained the company within the last 6 months, and so we do have a lot of people with questions and not sure. Like a lot of it comes around PDSAs and autonomy. We have everybody at the company now wants to run PDSAs, and and we have leaders saying they're just worried. It's like, are people actually doing their real work? Or are they just off doing PDSAs about various things? And so it really is just kind of finding that, helping them explain the reason for doing PDSAs is to improve the processes and also trying to not stifle innovation by saying every PDSA has to be approved by management, trying to find that balance. So yeah, there's a lot of questions around that sort of stuff coming up, and that's just, these are just the sorts of things that we just need to work out through experience, I think.
Thank you. Any other thoughts on that? I have more questions, and we're short on time, so I'll just keep moving along.
I think I've been fortunate that in dealing with healthcare providers, they've all been trained in systems, and the hurdle has been, for example, to take a physician who, when he sees a patient, is thinking very systematically, to get them to realize that they are part of a system and to begin to use that same way of thinking in terms of the operations of medicine. The other parts, statistical variation, the scientific method, I mean, they're all well-schooled in that. Looking at data, understanding confidence limits and things like that, they're all well-schooled in that. I actually, in general, interactions with groups, almost never mention Deming. If I'm doing, like a year or so ago, I did something we have an academy where we're training the upcoming leaders, the next generation, if you will, I did. But most of the time when it's just using the tools in a transparent way, in the context people are already familiar with in healthcare, and then those people that I mentor or spend more time with, that's the setting that I will talk about Deming, its principles, turn them on to things about reading. And otherwise, one of the challenges we would have in our organization in healthcare, there's just been, so many themes, if you will, that have gone through. You almost risk getting put into one of those buckets, the TQM thing, And right now, Medicare has written in their criteria for hospitals that you need to have a quality assurance and performance improvement program. So a lot of the principles from the system of profound knowledge I will articulate in that language, because that's the language that's dominating our space.
Interesting. Thank you. Next question. Lean and Six Sigma are important, widely adopted methods for improving business operations. Can they, should they, be integrated with the system of profound knowledge?
That's a good question.
Got an hour?
I think what makes them widely popular is that they fit the existing system of thinking. It doesn't stretch your imagination. You continue to look at parts in isolation. The Six Sigma focus to reduce variation is to achieve all good parts, which goes back to the interchangeable parts model. The Lean folks want to eliminate waste, to which I challenged one woman once, and I said, that's like getting rid of the fat. She said, yeah, like that. I said, as Mr. Higgins would say, whales have fat for a reason. So we have to live with it. I think that what I've been trying to do is introduce subtly to them, systems ideas from profound knowledge and Deming's work, and try to see if they'll nudge off the dime. And I find it's really hard. It's really hard. It's to the point that I'm not against tools. I'm not against tools and techniques. I like shovels and digging in the backyard. And I think the tools of Lean and Six Sigma, I have a problem when someone calls a control chart a Six Sigma tool. I said, wait, where's the labeling come from? But I don't have a problem with tools, calculators, things like that. But what I'm wondering is, what is the philosophy behind the tools? And very purposely have been trying to challenge, if Lean is about continuous improvement, then why isn't it called leaner? And that's why challenge to just say, there are these, and just looking for what I think are the apparent weaknesses of the part focus or the perfection focus, and just point out that contrast with profound knowledge, and then try to say, subtly, might there be something missing?
Yeah, we don't at Pluralsight see. We use Lean software development as that's the way we do software development. We're trying to get to a more flow efficient place, and there are some techniques that you can learn from Lean. In fact, there's a great book that recently came out called "This Is Lean" that really kind of describes what Lean's trying to get to, because Lean, I think, has been misrepresented a lot. But there's a lot of good stuff we can learn there that goes above and beyond what Deming taught. Like that notion of moving from resource efficiency to flow efficiency, just knowing that you have that choice is useful. So I think that I don't think we should be afraid to continue to evolve, just like one of the speakers said earlier, who was, that we need to think about what the masters were pursuing. and continue to pursue that. Right? I don't think we want to be stuck with just where we are in stasis.
Thank you. This one's maybe a little related, picking up on what you guys were just saying, and it's addressed to Ed. It says, can we change our brain physiology through meditation, or is that just reworking the pattern? So Bill's point about sometimes you can have a conversation with someone, but it doesn't really go anywhere because they're seeing that pattern and that's what they're in. So is it possible to change the pattern?
I think so. I think when Bob asked that question, I spent some time to address that. I don't think we can directly change the brain by will. It's not a will thing. It's putting yourself in an environment and doing different things that change the brain. The brain's purpose is about future action. There's actually a little sea squirt that swims around in a larval stage that has a brain. It attaches itself to a coral and becomes sedentary, and as soon as it attaches itself, it dissolves its brain. Right? So that's pretty powerful evidence that the brain. That's pretty powerful evidence that the brain is about motion and about future in terms of making sure you survive, keeping the organization structure intact, and procreating. Meditation I would look at as a context where with repetitive practice you can change the synapses in the brain and come up with a different perspective. I think the difficulty that I see, and I run into the same thing as Bill, is people aren't really in those settings hearing the intent. They're listening for what they're going to say next, kind of thing, and there isn't the space in the storm for things to stick. That's why I think finding crises where the as-is process gets stuck is an opportunity to generate a different kind of listening, which can lead to different perspectives.
And Kelly, let me add, as Ed was saying, another thing I try to do is find examples where people are acting in a way that I think is very consistent with profound knowledge, and ask them about that, and have them compare what they do there to what they do at home, and get to realize it's two different sets of behaviors. It's the same person. So why at home, why when you go to the parking lot, why when you drive into the mall do you sort through parking spots? And why at work do we act in a way in which we think all parking spots are the same? So you particularly chose that chair at the table, yet you're telling me all these bearings are the same. So it's trying to get them to realize there's a patterning, there's two different patterning mechanisms going on. And then use the elements of profound knowledge, to reinforce, to explain those behaviors. And then I find they, if they're willing, then you could create a new pattern. But they have to become aware of that.
This was a bit related, and it sounds like someone working on this right now. What advice would you give about countering hostility of those folks who deny the existence of systemic vulnerability, and how to deal with individuals in our own enterprise or a large organization? How can we start to make this transition? I sort of messed that up. Let me try it again. Yeah. I thought you would, only if I can do a better job. What advice would you give about countering hostility of those who deny the existence of systemic vulnerability, and how to deal with individuals in an enterprise or large organization? That's the first part. And then how can you start to make this transition?
Over the years, as I look at the areas I've been successful, they've been opportunities. The areas I've been very successful have been opportunities that have shown up in the system, and they're usually around crises. I I know of no, I've not been effective to the point, I don't even try anymore, usually, to take on the system's immune system, because the response that's mounted, and as you get to understand the system, you begin to see where there is an opportunity maybe to use leverage to shift something. I guess that's how I would say it. It's not, I mean, I've not had the experience of the system suddenly transforming itself. In healthcare, we use death if somebody dies, although the system has a way of rationalizing that off and all the reasons, just no different than the Ebola example. But when it happens, when it shouldn't happen, like an elective procedure, that's an opportunity that can stop the everyday as-is automatic running of the system, and an opportunity to get people to reflect. And usually there's something that comes out of that that can be positive. But I guess I don't have an answer to that question. That's just what I've learned to do, and it's a little bit like if you have a 10-foot sandwich, you can't eat it all in one bite, or you choke and aspirate. And you pick the areas where things seem most fertile to introduce change, or you take advantage of the outside influences, like the Medicare example, that suddenly aligns the system because dollars are involved. Transparency, it's going to show up in the public domain. And the other thing that happens is people go, whoops, we're not as good as we thought we were. Yeah, malpractice is, at least in California, where we have some limits on pain and suffering, it's not a big driver at the hospital system level. Our experience is actually very low compared to hospitals. So in our particular area, it's not. It is more at the individual physician level in terms of things that they're doing that probably contribute to cost. But it's a very inefficient way to improve quality.
Thank you very much for your questions. Obviously, I did not get to all of them, but we're out of time. So I want to thank the panelists for their help. And don't go anywhere because we're switching panels right now.